Hello, my name is Nina Wines. I'm grateful to be able to speak to you at this wonderful forum, Congress, Laser Assisted Photodynamic Therapy. I'd like to thank the conference organisers for the superb job they've done in these difficult times. I'm coming to you from Sydney, Australia, and we're very sad that we can't have you here. And most of you, I'm sure, were hoping to come and see some of our beautiful koalas and animals here. But I'll take you on a little virtual tour of some of the beautiful parts of our amazing country. This is stunning Bondi Beach, which I'm sure you've all heard of. And Australians are extremely active people. We love to be outdoors as much as we possibly can be. This is Bondi Beach, and it was one of the first areas to be closed down during COVID, as it's such a popular spot. And as you can see, Australians love to sunbake. The head of our Australian Medical Association did a study of 1,400 medical students and found that 70% of them still love to get out and do a little bit of sun baking, and many of them don't effectively use sunscreen. So if we haven't mastered the medical students, it's no surprise that many of our patients find nothing wrong with tanning. This is why in our day-to-day practice we have to be experts at dealing with all ranges, a whole range of sun damage, as it's very much part of our day-to-day practice to see a lot of field damage of actinic keratoses, large superficial BCCs and Bowen's disease. It's all part of our day-to-day work. So photodynamic therapy has been a very useful adjunct in our practice, and so I'm so delighted to discuss my experience with it in our practice as mentioned, I'm Nina Wines, and this is I co-founded Northern Sydney Dermatology and Laser with Dr. Dawes Higgs pictured here with me. We have a team of dermatologists who work with us. There's such a lovely, capable, excellent bunch of medical practitioners. We're very fortunate to work with these people, and we aim to cover all aspects of dermatology in our practice. So I'd like to talk to you about my experience with laser-assisted photodynamic therapy in my practice. So we will talk about what laser-assisted photodynamic therapy is, why it has superior efficacy and remission rate for field actinic keratosis and some non-melanoma skin cancers, and how to confidently perform it. I'd like to show you how to confidently perform it and take you on a patient's journey through treatment so you understand the process. So conventional photodynamic therapy responses are thought to depend on the type and thickness of the lesion, with a lot of poor response due to the lack of penetration of the product at depth of the lesions. And it's been shown that pre-treatment with ablative fractionated laser increases the uptake of methyl aminolevulanic acid into the dermal layers, the deeper layers. So studies do show, many studies have been performed to show superior clearance and long-term remission rates for field actinic keratoses, for Bowen's disease, superficial BCCs, and early SCCs. And there have been multiple randomized controlled trials and meta-analyses performed. So how does it work? The ablative laser creates these microscopic ablative zones with this surrounding coagulation, and the drug can therefore get to the site, to the lesion, to the target much easier, and can diffuse through the coagulated tissue. And that's why it's so effective. And this is it, and on a histopathological level, you can see this zone of coagulation where drug can penetrate and diffuse easier. In our practice, we love this device, Candela Core. We use it for so many things. It's just superb. Scar management. We use it for rhinophyma. We use it for, we've got some aesthetic uses for it. We use it for vulval issues. It's been such a superb laser laser to have in our practice, and I'm not sponsored by them or have anything to do with it. I just genuinely love this device. The device comes with many different settings, so you can do a light setting, an epidermal setting, or a deep setting, or a fused setting. This is the two main parameters you can control is the density of the two main settings you can control is the density, the number of dots, and how deep they go. And this is the one that we're talking about today, the deep setting. So the laser setting can influence the drug amount, the drug delivery rate, and the drug biodiffusion, which we'll talk a bit about more. And this makes a little bit sense. I drew this graph to try and make a little bit more sense of that. So if you set it at a 5% density, you can see how many little microscopic thermal zones you create, as opposed to a 2% density. So hence you're going to be delivering more drug with this density than you would with this density. So this was a study conducted and published in 2012, just showing how the laser treated skin showed after 60 minutes showed as much fluorescence as to the non-lasered skin after 60 minutes. So it took 180 minutes. So that the amount of fluorescence at 60 minutes equaled that at 180 minutes without laser. So it remarkably reduces the incubation time that is required. So it really accelerates the protoporphyrin 9 development in photodynamic therapy. So I hope that hasn't been too confusing for you so far. I'd like to push on more towards some of the more clinical features of this treatment. This study, just to show and prove its results in actinic keratoses, 87% clearance versus 61% without laser. Longer term efficacy, 60 to 67% versus 17 to 45% without laser, and absolutely reduced recurrence rate of 8 to 10% versus 22 to 27% at 12 months without laser. And you can see a very, very good result after treatment. Great study showing its benefits for Bowen's, and which can be very difficult in lower legs when you don't want to do grafts and etc. Particularly elderly patients have found it very, very helpful. It shows a 78% clearance versus 44% without laser. Recurrence rate is 99.3% versus 41.38%, which is incredible. This was a 5-year follow-up study. So excellent results for Bowen's disease where surgery would be difficult. And certainly this long-term follow-up study showing low recurrence rate compared to no laser. So this is non-laser assisted photodynamic therapy. This is laser assisted photodynamic therapy. So superb results. Also, this recent study recently published using laser assisted PDT for microinvasive squamous cell carcinoma. They did one treatment as opposed to one treatment with laser assisted photodynamic therapy versus 2 treatments with non-laser assisted photodynamic therapy, and showed it was just equally as effective, with a recurrence rate of 12% versus 63% at 24 months. So the key take-home points were that it wasn't more painful. There was no difference in the cosmetic outcomes or adverse events, and one treatment with ablative fractionated laser was better than 2 of the non-laser assisted treatments. They did note higher recurrence rates was more likely with greater than 2 centimetre lesions if that had previous treatment. So here we go. I'm going to take you on step-by-step how to perform this procedure. As I'm more of a practical dermatologist. So pre-treat with laser. Personally, we don't need to do local anaesthetic before our ablative laser. Patients really can tolerate it with a Zimmer. they would tell me 2 out of 10 in terms of discomfort for that. The ALA application, you can do a 5-ALA formulation in acetone. All the studies are with Metvix, but I find Metvix needs to be kept on for longer than the 5-ALA to have the same effect. So I tend to incubate 60 to 90 minutes for 5-ALA or 3 hours for methylamino-levulanic acid. And then all sorts of lights can be used to activate the photodynamic therapy. So I'm going to take you on a walk through 2 cases. One is just where I treated a scalp only, and the other is a patient's journey for a full face treatment. So this is a field actinic keratosis on the top of the scalp. He came in and we lasered the top of his scalp without previous local anesthesia. He did not find that uncomfortable. And this is me setting up the core device. I use the deep, showing you here how I use the deep setting, and I tend to set it at 30 joules, millijoules, 30 to 40 millijoules, sometimes 50 for scalp, but I do vary the depth depending on the thickness of the lesion. If it's really superficial, I'll go 30 millijoules. If it's a deeper, thicker actinic keratosis, I'll go to 50 millijoules, and tend to stick at the 5% if I want a lot of uptake, or go down in a lower percent if I don't want such a vigorous reaction. So I adjust the settings to the clinical features, with thin AKs treating at 30 to 50 millijoules, 2 to 5%, and thicker actinic keratosis going 50 to 70 millijoules at 5%. No local. I really do find that I can get away without topical local anesthesia beforehand, but and the patients really do tolerate that with a Zimmer. This, however, the acetone 5-ALA application can be painful for patients, but it's very short-lived. And if you use a Zimmer cooler, they can tolerate it with warning, or you can use some additional like nitrous oxide to reduce pain if needed. So this is the patient a few days after treatment, very good reaction, and this is him 3 months post-treatment. So very, very clear. I just find that this is very reproducible. We get good clearance in comparison to other treatments that I do use for field treatment, such as Efidex, Imecamod, photodynamic therapy alone without laser. So I mean, you have to choose the field treatment to the patient. I find it's a very each of them have their benefits for each individual patient. So this is another long-standing patient of mine. He had terrible field actinic damage. He's a surfer, he's a gardener, a heap of sun damage. So this is me performing the laser prior to treatment, and just going through very simply just creating those microscopic coagulation treatment zones so that I can enhance the uptake. I tend to like to apply the ALA as I go, because I did read a study that it's best to apply it as soon as possible. Within a few minutes, you get the better result of uptake of the product into the skin. So I sometimes in between the treatment areas, I do use, if there's not that much visible damage, I do use sometimes the standard emery board, and in the really heavily actinic damaged areas, I'll do the laser. And this is beautiful nurse Avi setting up the tray. This is how I set up for the procedure here. And she, as you can see, we've dressed the nose, and then I've lasered here the face, and we'll apply the amino-levulanic acid. And I'm asking him, are you in pain? Are you uncomfortable? And he's saying no, it's good, but it does get a bit ouchy when you've done an intense treatment in an area when the ALA is applied like this. But, you know, you can see I've used ALA and acetone for this, but I do use a lot of Metvix with laser-assisted photodynamic therapy as well, mainly. So I've dressed him up and he will sit and incubate. And this is him.
This is Mark 90 minutes later. We've just removed.
We incubated him for 90 minutes with the 5-ALA. And it's a little bit, you know, it's very red.
5-ALA. It's had now time to incubate and form protocol for 9.
And then in his case, we activated it with BBL because he had so much photo damage from his gardening and his lifestyle of surfing. We wanted to improve some of that, so we activated it with the Cyton device. So this is his recovery, his journey. Day 1, it was pretty awful. Lots of crusties, nose was pretty scabbed up there, but he felt okay. This is day 4. I was a bit over it at that stage. Day 7, when he came into practice, skin's all peeling off. We used a Visia to take the photos there. And 2 weeks, much, much better. So this is his overview.
Hi, my name is Mark. I've had a lifetime of sun exposure due to sports, surfing and working outdoors. I had very bad skin damage from all the exposure. I was recommended to do the PDT treatment, which I have to say has been absolutely fantastic. I had skin discoloration, sunspots, broken capillaries, etc. And after the treatment, my skin has come back really well, and I've got to say it's probably the smoothest and the best and the healthiest and even coloured in the last 20 years. So the team at...
But what about laser assisted photodynamic therapy for non-melanoma skin cancers? The results, as mentioned previously, for Bowen's disease are really impressive, and we've certainly been finding it's really helpful, particularly for elderly people. You don't want to put them through really difficult flaps and grafts, surgery. We've just found it really helpful for those people, or for difficult Bowen's disease. I've got some patients who are just covered in Bowen's all over their lower legs, just from the Australian outdoor lifestyle. It's not pictured very well here, and I'm sorry, but she has a large quantity of Bowen's disease. And so it's just the same process. Basically, we pre-treat. This is ALA, but as mentioned, I do a lot of Netflix as well. And then we put the plastic wrap on and then dress it and sit her in a duck room, and have treated her with great success. So because every doctor has their own way of doing it in our practice, I have designed this photodynamic therapy order form so that the doctor can specify whether they want pre-treatment for laser, if they want to use 5-ALA or Metvix, the incubation time that they want to use it for, and I just easily designed this myself, and it's been a really effective tool for us. So some lessons I've learned along the way. This poor patient of mine who I've been seeing for many, many years, we've tried absolutely everything for her hands. She really hates cryotherapy, really, really hates it, but we've tried so many different things for her field damage, Effidex, Aldara, you name it, we've tried it, plain photodynamic therapy. So she just was, she bowls competitively, and she was just getting really down about her field damage. And I tried laser assisted photodynamic therapy on her. This is her immediately after. I dropped the parameters of the laser dramatically because I was worried about, being off face treatment zone. And this is her day 1 afterwards, but she found it quite painful, and it took forever to heal. Really took forever to heal in her, and I learned a lesson from that. But the results was great. She's very, very pleased months down the track, but a lot to put her through. So a lesson I've learned along the way. So thank you for letting me discuss my experience with laser-assisted photodynamic therapy in our practice. It's been a definite useful thing for me, and I find that I've gotten some superb results. Please feel free to scan this QR code and to view these slides, and most importantly, come visit anytime. We hope we can see you during when the world gets back to normal. and we'd love to show you around our beautiful country. Take care. Bye now.